Hi there, I'm Andrea Brognano, and I'm a licensed mental health clinician specializing in anxiety, depression, ADHD, and relationships. And I'm here today to talk to you about anxiety disorders, types, the symptoms, and the treatments. We're going to go over what is anxiety, when is anxiety a mental health problem. We'll review the different types of anxiety disorders and the symptoms of anxiety, as well as the causes of anxiety and how to treat anxiety. First, what is anxiety? Anxiety describes the emotion of fear, which occurs on a spectrum that ranges from mildly nervous or worried to the extremes of feeling completely panicked. Anxiety can be normal when it's situational, meaning it occurs in response to a specific situation and goes away on its own when the situation is resolved. So, when is anxiety a mental health problem? Fear is not a rational emotion. So, even normal anxiety sometimes seems like an overreaction, but frequent anxiety that is excessive or unexplainable is abnormal. So if you're experiencing symptoms of anxiety like catastrophic or racing thoughts, increased irritability, restlessness, or increased heart rate and nervous energy for what seems to be no reason, it might be worth exploring that a little bit further. Did you know that there are several different types of anxiety disorders? Anxiety disorders describe a category of mental health conditions that share common symptoms but have different patterns of onset, duration, and frequency. Many anxiety disorders are distinguished by the specific events and circumstances that trigger the symptoms or false alarms described just before. Some of the more common types of anxiety disorders are generalized anxiety disorder, or GAD, where there are symptoms of anxiety triggered by a wide range of circumstances, or sometimes for unknown reasons. Social anxiety disorder has symptoms of anxiety which occur in a specific social interaction or setting where a person is afraid of being judged or maybe even rejected. There are specific phobias. These are intense symptoms of anxiety triggered by a specific thing, maybe a fear of spiders, situations such as heights, or activities, maybe public speaking. Panic disorder is an anxiety disorder categorized by panic attacks and intense fear about the possibility of future attacks. Anxiety disorder is related to an underlying health issue or related to the effects of a prescribed or illicit substance. Separation anxiety, which primarily affects children, but it can also happen in adults, is characterized by extreme anxiety when separated from loved ones, usually caregivers. Unspecified anxiety disorders, which include some symptoms of anxiety that don't match other known anxiety disorders, but do cause significant distress or impairment. Obsessive compulsive disorder, or OCD, is not technically an anxiety disorder, but is categorized by high levels of anxiety, intrusive thoughts, and ritualistic behavior. Post-traumatic stress disorder, or PTSD, is not an anxiety disorder, but involves symptoms of anxiety, avoidance, mood problems, and recurrent memories following a traumatic experience. Anxiety symptoms, depending on the specific disorder a person has, their symptoms can vary. Each disorder has a detailed list of symptoms that licensed and mental health professionals will reference to determine a specific diagnosis. Because anxiety is a common feature of all the conditions that I just listed, there are some similarities in the symptoms that people with these conditions may experience. Some of the more common symptoms of anxiety that people will report include feeling intense, irritable, or on edge, racing or worried thoughts, trouble focusing or concentrating, changes in eating or sleeping patterns, restlessness and trouble sitting still, avoidance or fear situations, sweating, shaking, or other unusual sensations throughout the body, feeling disconnected, zoned out, or disassociated, or feelings of panic attacks, which can include extreme fear, racing heart, or trouble breathing. What does anxiety look like? People of all ages can and often do experience anxiety, but the signs of anxiety can vary depending on a person's age. In children and in teens, anxiety can surface behaviorally or can mimic other types of mental health or physical illnesses. In children, there are younger children can't always describe their emotions, so physical symptoms of anxiety are common, and these might be complaints of a stomach, headache, or chest pains. In teens, anxiety can also show up behaviorally. Anxious teens may seem moody and get more confrontational with their teachers or parents or caregivers, and they may begin socially isolating themselves. This is when their grades might drop and their changes in sleep or eating patterns happen. In adults, some people experience more physical symptoms like a racing heart, upset stomach, muscle tension, and migraines, while others might just have overthinking a little too much. So what causes the anxiety? There isn't one specific cause or development of an anxiety disorder. Experts believe that interaction of genetic vulnerability with stressful life and potential stressful events can trigger an anxiety condition. A person can also experience anxiety from having any underlying medical condition, taking certain medications, or a combination of any of these factors. Luckily, anxiety disorders are highly treatable. Treatment for anxiety disorders can include therapy, medication, and even lifestyle changes that can help reduce the symptoms. Therapy for anxiety disorders is a frontline treatment and can be highly effective at helping people learn skills and strategies to manage and reduce the symptoms. CBT and exposure therapy are great options. Medication options for anxiety disorders. At times, medication for anxiety may be recommended as a part of the treatment. The three most commonly prescribed types of medication are antidepressants, beta blockers, and benzodiazepines, but other medications are also sometimes prescribed. As far as support groups, there's a vast evidence indicating that support groups can have a positive impact on mental health. By providing moral support and a feeling of social connection, these peer-led groups can help to reduce symptoms of psychological conditions, including anxiety. You might consider joining an online or in-person self-help group to help you feel less alone, decrease your stress, and improve your symptoms of anxiety overall. Anxiety disorder is treatable, and it's important that you get the help that's best for you. Only you know yourself best. So try out different ways to navigate and gain support. Wishing you well.